tell me just some major factors that play into a teen pregnancy when a teen becomes pregnant?
I think there's two different aspects of teen pregnancy. One, the social implications, the fact that pregnant teens, one, they may have gotten pregnant because of the fact that they haven't had the education, they don't know how their body works, they don't know how to get pregnant, or how they got pregnant, and the fact that after the baby is born, if they drop out of school, only about 1% of those individuals will ever go on and be able to get out of poverty. If they end up having 2 or more children when they're still teens and drop out of school, neither them or their children will probably ever get out of poverty. The other aspect of teen pregnancy is the physical, what is happening to her during her pregnancy and what is happening to her baby. Most teens, their bodies are not developed enough yet, and so there's always complications. A teen pregnancy is always considered a high-risk pregnancy. And pregnant teens are more likely to develop gestational diabetes or preeclampsia, which is high blood pressure. They have a higher chance of having a Downs baby, and most people think, oh, that's just older women. Well, it's also younger moms. And then because their physical body may not be developed enough to try to carry a baby all the way to term poses a big problem. A lot of teens, and here in this community at one hospital, 42% of teens delivered a preterm or low birth weight baby. And so that aspect of the fact that their children, their babies are now in the NICU, they have complications, respiratory problems, cardiac problems, neurological problems that may follow them for the rest of their lives. And so you have to look at what's happening with mom during her pregnancy and what is that going to do to her baby.
What can we as community leaders, as parents, as teachers do to help protect these teens from getting pregnant?
I think one of the big aspects is we've got to teach them how their body works. We've got to teach them responsibility and consequences of being sexually active, because for many, they have no idea, it's a game or it's something fun to do, or it's a way of joining in with a group. If I want to be in this group, then the peer pressure is I have to be sexually active, but they don't know the consequences and the responsibilities that go along with it. I think as a community we need to be able to teach them, and a lot of parents have come up to me and said, we want to teach our kids, but we don't know what to say either. We don't know the proper terminology, we don't know the lingo that the kids are used to hearing, and so it's kind of an educational process for everyone.
What type of programs can the community and the schools have to help educate the parents as well as the students at the same time?
One of the programs that I helped develop is called Teen Straight Talk. And it's a comprehensive sex education program for both adults, and we have parents, grandparents, aunts, uncles, foster parents, youth leaders, nurses, just about everybody come, and then kids 10 through 18. And we divide this program into two. The first half we talk about how to deal with teen pressures and peer pressures and body image and bullying and depression and suicide, because many of those aspects are the reasons teens go into becoming sexually active. And then the other part is the comprehensive sex education part. We start off with talking about body parts, both boys and girls, so that they have the correct terminology, because lots of times if they're trying to describe, well, something's going on with this and they don't know how to describe it or how the correct name for it. Then we go into STDs, because Lubbock has such a high rate of STDs. We talk about chlamydia and gonorrhea and syphilis and trichomonas, and we talk about the viruses such as herpes, HPV, HIV. We talk about the consequences that if they do contract one of these, if they don't get treated, and for women and teen girls, 75% of them may not even know they have signs and symptoms until it becomes very detrimental. They go into pelvic inflammatory disease, which can cause women to become infertile. And we talk about the aspects of these diseases on the guys too, because boys can get an infection, they do get STDs, and on them it can cause infertility if it's not treated. So we talk about that. We talk about abstinence, because abstinence is the number one way to prevent an STD or prevent a pregnancy. But we also talk about contraception, and we talk about using condoms, and the fact that condoms for many of the infections will help to prevent getting it, but the condoms have to be used every time in the correct way. So we talk about how to put it on correctly, and the difference between latex condoms and those that aren't latex. We talk about other types of birth control, and we also let them know that, okay, the birth control, if used correctly, will help you to prevent pregnancies, depending on what type you use. Has the right to pressure you into being sexually active. And then we end it by saying it's, being sexually active is a big decision, and it's not something to go into lightly. Some of the programs in the schools are abstinence-based. Some of them, they're starting to have in the middle schools a little bit more information, but in many cases it's still abstinence-based, so they're not getting the whole picture.
Why do you think that West Texas, Lubbock, has the highest STD rate and the highest teen pregnancy in West Texas, and for its size in Texas itself?
I think part of it is the fact that Lubbock is isolated. Some of the kids have said, well, there's nothing else to do, so we're sexually active. Just like, the other reason we have a high drug use and alcohol use sometimes. Because we're isolated and it is a conservative area, and the fact that we teach mostly abstinence, but a lot of the kids, if there's not anything to activate their time and keep them going, they're going to experiment. And and being sexually active is a form of growing up. It's just that they're starting younger and younger and younger. When we have young children pregnant, and right now we have a 9 and a 10-year-old, but we also, the other problem we have here is that we have the highest rate of child sexual abuse in the state of Texas. And so we try to teach our young people not only in the consequences and responsibilities of sexually active, but if somebody is trying to force themselves on them, or to sexually abuse them anyway, that it's important to go and tell somebody, because your perpetrator is going to say, if you tell anybody, I will hurt you, or I will hurt your family, or I will do something else, so you've got to keep it quiet. And many of these young children are afraid, and so they will endure sexual abuse over and over and over because they don't want to tell anybody. And it's important for the community to say, okay, we're here for you, and you can go to any of us, and we will help stop it.